Mxiety. I am on tonight with the wonderful Dr. Ursula Whiteside. Say hi.
Hi, everybody. I'm so glad to be here. Thank you.
Thank you so much for taking the time to hang out with us. So the way this works, you guys, I'm about to open up the question queue. So, of course, whenever you're ready, start throwing those questions in one at a time. Exclamation, the letter Q, and then your question after that. Dr. Whiteside's specialty is dialectical behavior therapy, which we're going to ask her a ton of questions about. But if you want to know anything else, contribute, because that is what is going to make this conversation well-rounded. You being part of it is what makes this awesome and different, and what makes this like an awesome conversation. I know I already said that. So here we go. Yes, the links for, thank you moderators for reminding me, here is where you can find more information about Dr. Whiteside. So I'll stop babbling and let her introduce herself.
Yeah. Hey, everybody. I am a clinical psychologist. I started my training way back in 1999 at the University of Washington. But I do a lot of work on research around suicide and treatment for people who are having suicidal experiences. And then I see people who are suicidal as a therapist. I treat just a small group of people. I don't have a very big practice. And then I do a lot of training. So I train healthcare providers and people called peer support specialists.
Okay.
On how to work with people who are suicidal, to do so in a way that's like compassionate and
Right.
useful and evidence-based. And then I'm someone with lived experience. So I talk openly about having had suicidal thoughts myself. So
Okay.
I think
Wow.
those
Wow.
things.
Is
Yeah.
that how you got into this? Like you lived through it and you were
Yeah.
curious, or how did you get into mental health in general?
Yes and no. So growing up, I had a lot of anxiety and depression, or at least now that's what I know it is, right? I didn't know what it was at the time. And so I wanted to understand, like, how is it that some people, seem to do well all the time, or which we actually know isn't true, but how some
Right.
people seem to like thrive and other people don't. And when I started taking psychology classes, I realized, like, actually there are things that you can do, you can learn to
Mm-hmm.
change that.
Mm-hmm.
And then I started working with Marsha Linehan, not because I had been suicidal, but because she was doing such a really cool treatment. And we'll talk about this woman, Marsha Linehan, a lot while I'm here, because she developed this treatment called Dialectical Behavior Therapy.
Awesome, awesome. I'm excited to talk about her. She deserves all the bells and whistles that we could possibly give. But
Yeah.
so you studied there, and so then what was your primary, I guess, focus of study once you decided, hey, psychology is my jam, I want to keep doing this?
Yeah, I think I remember being an undergraduate before I transferred to the University of Washington and thinking, like, man, there should be this stuff that's way easier. Like, it should be that anybody can go and, like, for example, provide feedback or provide information about how they're doing, like what their strengths are, what they're struggling with,
Mm-hmm.
what their symptoms are, and
Mm-hmm.
then they would turn around and get some personalized, useful information that would help them in recovery. And it would be great if people who've been through it help deliver that information. So I was thinking that before I was even in psychology, really. And it turns out I'm still kind of doing the same thing. So we'll take that.
Just figuring it out, just doing your best and figuring it out, which is like
Yeah,
what all of us are doing all the time.
that's right. That's
But
right.
so I guess you yourself are, as a therapist, do you go to therapy?
I do, yeah. There have been times where I went to therapy a lot. I took a break for a little while. Now I see a therapist about once a month or once every month and a half. So I would say like maintenance therapy. But I think all therapists really should consider being in some kind of ongoing therapy, because we need to be mindful of ourselves. We need to
Right.
really be mindful of ourselves and take care of ourselves, because we're doing
Right.
work that is important and challenging sometimes. It's hard to always be helpful, or when it's hard when you want to be helpful and sometimes you're not. That's a painful thing. For
How did
example.
how did you transfer over from going, okay, this stuff is really interesting, I'm gonna go to grad school, like, and figured out, basically, sorry, my question is getting like lost in my head, but did you at any point, like, was it self-serving that you were going to, okay, now I'm going to become a psychologist and help people doing this because
Oh, yeah.
I'm learning from it?
I think that anyone tells you that choosing a profession of psychology isn't self-serving in some way is probably not totally telling the truth. Honestly, like, because I get so much out of helping other people. And honestly, part of it is like just a distraction from my own brain, which is can be a total jerk sometimes. Like when I get to pay attention and really like focus on somebody else and see how I can be of value to them, I get some relief. So there's that selfishness there. And if I weren't aware of that and that was completely like driving the way I reacted in situations, that might be a problem. But I know it's a thing. I know that to me that's valuable and drives why I do this. And so I can be mindful of it and make sure it's not a problem either.
Got it. Got it. And then, so then you selected dialectical behavioral therapy.
That's right.
Okay.
Yeah. So the woman who, so in high school, oh, it's so funny when you're growing up and you're a teenager, right? You're in elementary school and you have this pretty strong sense of identity, or at least I did.
Sure.
Like, you know who you are, right? And then you get to junior high and you're like,
Who?
I don't know who I am anymore.
Right.
And something happens, and I had been the kid who was just really solid in who I was, and then all of a sudden, in the combination with moving and being in poverty and a bunch of other things, just sort of really started questioning everything about me, including things about my appearance and stuff. So all of that is to say, like, in high school, I started to have more concerns about like my weight and shape, which is such a pain in the ass because it takes so much of your mental energy.
Yes. There's actually research behind that, right? That women specifically who focus on their weight end up like using less of their mental energy on work. Like they do worse at work, women who are on diets versus women who are not on diets. So
sad that we do this to ourselves. Yeah. Anyway, I mean, I just wish that I could, you can't tell teenagers what to do, but I wish I could be like, guys, like, it's not worth it. It's like, so I promise you, it's going to seem like it's the thing to do, but I promise you it's just not worth it. It never works out the right way. But anyway, I was a long way of getting to the point where I said, well, I started out in a research clinic that was around eating disorders because I wanted to understand that better and also be helpful, because it was not only me that I saw, it was all the people around me, not just women, or lots of the people around me, not just women. And while I was at that eating disorders research clinic doing a lot of data entry, a lot of grunt work, the woman looked at me who ran it and said, the woman who I said, what do you think I should do? And she said, the woman whose work I'm most excited about is a woman named Marsha Linehan, and she does what's called treatment development research. And her treatment is focused on emotions. Okay. And so I was like, I want to know more about that. So I applied to the University of Washington, moved from the University of Minnesota and the state of Minnesota to Seattle, and changed my life to go work with that woman. And I don't know what my life would be like if I hadn't. So it's so great to see all the people who are joining us. I love it. Hi, Talis.
Hi. Hi, everybody. It is really cool. The interaction live is what makes like a huge difference here. I really enjoy it. And that it's in real time. And if people ask questions, you can poke in and directly. Do you want to answer questions now, or do you want to leave them to the end? That's totally up to you.
Either is fine with me. Oh, okay, cool.
Okay, so so my next question is, so just give us a background in DBT, dialectical behavioral therapy, behavior therapy. What makes it different? So there's cognitive behavioral therapy, and we talk about that a lot on stream because that's the type of therapy that I've experienced the most. And yeah, so if you could tell us a little bit about DBT.
Yeah, so cognitive behavior therapy, well, so there was, when therapy first came about, there was like the Freudian type of therapy that most of us hear about. We first start learning about therapy, like psychoanalysis, where there's the couch and that kind of image. And then like in the 50s, then there became, and I know that you know a lot of this, so forgive me, but there was this movement of behavior therapy, which was this understanding of our behavior is a lot impacted by whether we get positive reinforcement or we don't get positive reinforcement. And that was the rise of behaviorism. And then came the wave of cognitive therapy, or cognitive behavior therapy, that said, wait, you really need to have thought involved. And so cognitive behavior therapy, and then dialectical behavior therapy, Marsha Linehan, the developer, would say it's essentially like a type of cognitive behavior therapy, what's focused specifically on emotions. So I would say it's a type of behavior therapy that's very emotion focused. And if you were to get DBT, like if you were to get the type of DBT that has been studied in research, it would mean that you would get therapy for 6 months or a year, where you went once a week and saw your individual therapist, and you went to a group, which is actually a class, not like a regular group class, where you learned coping strategies called DBT skills. And that would be 2 hours to 2.5 hours a week. And then you would have phone coaching with your therapist, so that, like, say you get in a fight with your partner and your suicidal thoughts arise, and your coping strategies aren't working, you could reach out and say, here's what I've tried, can you give me some suggestions for help? And you could get some support. So it's like individual therapy, the coaching, or excuse me, the class on skills, then coaching via text or phone. And then the therapists go and they do their own consultation team. So it's called therapy for the therapist, where they go and they say, here's what I'm struggling with in my work with my patients. Here, I'm starting to feel anxious. I need help with my anxiety around working with my patient Susan, because I'm worried all the time she's going to kill herself, and I think that's getting in the way of my treatment. So anyway, that's kind of what dialectical behavior therapy is. There's actually very few places you can get the very standard traditional type that's been research studied. There are a lot of people who've had some training in dialectical behavior therapy, but most are not trained in the way that the research studies have been done. So not to the level of rigor, but that doesn't mean they're not valuable. It's just,
I was going to say, does that kind of give DBT a bad rep then, or are people like aware enough and really well-meaning and doing right?
I think that the people that, want to learn DBT, the clinicians that take the classes, even if they don't get intensively trained, like was the intention of Marsha Linehan,
right,
they still learn valuable stuff. And I can tell you, for an example of a way that I'm trained to do it, to get people training who can't go away for a week-long course because they don't have the money, or they couldn't leave their organization. So I think there are other ways for people to get the benefits of different pieces of DBT.
Got it. Okay. So I know that one of the things that that's come up a lot is that workbooks are really important, because it's part of the coaching and part of the classes and everything. And I did not realize, because I had only done workbooks on DBT, I did not realize that this was a touchy sore subject. So do you mind kind of diving into that and maybe exploring that a little bit with us?
Sure, of course, absolutely. Yeah, so Marsha Linehan, when she first released her treatment, it was in 1993. And so it was 2 books. It was a book for therapists. It was like a thick, really, really dense, but really, really good book on the treatment. And then it was this actually thinner book that was paper, and that was intended for patients, or for leaders of groups to give to patients. There are a lot of handouts and worksheets. And then just a couple years ago, she did the updated version of that. So this is like the updated version of her original from 1993. You can see all my notes and stuff in there. Cool. And then this is like something totally new. She created a different guidebook for this, and before they were one, and they were much smaller. So this is,
wow. So it's super comprehensive now.
Yeah, it's super comprehensive. And I think maybe what you're alluding to is other people have written DBT workbooks and stuff like that. Is that what you're thinking?
I am thinking about that, and just the fact that some people talk about the fact that, like, oh, it's not real therapy because a workbook and sitting through a workbook is not going to help you as much. And some people feel like because so much of DBT is classroom focused, that like it takes the human part of it out of it. But what you're describing is a very, very comprehensive way of talking to a patient. So it's really unfounded, but that is the criticism that I've caught from the side. Yeah. So
yeah, we just want people to have as many resources as possible. So like my cousin in rural Minnesota, there are no DBT providers around there, and there are no people that specialize specifically in some of the struggles that she has, but she can get this workbook and
Mm-hmm.
start to work through it,
Mm-hmm.
just getting stuff that she would never otherwise get. Yes, in an ideal world, it would be fantastic if she had the right therapist and the right resources, but that's so hard.
Yes.
Um, it's
Yes.
so hard. So, yeah.
Tally, it's more teaching skills than sitting through and talking through issues. I mean, yes and no, because you're still talking through the emotional aspect of it, right? Right? If do I have that right, Dr.
Right.
Whiteside?
And I think what he's referring to is in the class, what you do is like the first half of the class is that you go over what your practice assignment was.
Okay.
So it's like essentially like practice review or a homework review if you want to go with the traditional class format. And then the second half is where you go over, you learn new content. So it's really that first half where you're taking what you did over the past week, you're talking about it, and you're saying, okay, I had this total blow up with my boyfriend on Thursday. I tried opposite action and here's what happened. It didn't work.
Mm-hmm.
And then the rest of the group is saying, well, would you like some feedback? Or the group leader is saying, I have some thoughts on that. Would you be interested? And in that way, you are talking about yourself and your experience, but it's not processing. It's about how could that work better? How could we get that skill to work better? Is there another skill or coping strategy from this list that might work?
Yeah.
If that makes any sense.
Yeah, no, it makes a ton of sense. Everything is making a ton of sense. Don't you worry. Thank you everybody for the follows. I just don't vocalize it too much while I'm enthralled by what you're saying and learning more about this. So DBT has helped me. I'm one of those people that, again, I mostly went through cognitive behavior therapy, but DBT was something that I got through a workbook because it was just something that my therapist was suggesting to kind of add on to my current therapy, and we could talk about it during sessions, but the idea was to like go away and kind of figure out this just kind of start thinking about things in a different way. That's really what it is. Thinking about my emotions in a new way versus the way that her and I talk all the time, which is, there's nothing wrong with that. But I honestly think that book saved my life, both as somebody who's had suicidal ideation throughout my life and as somebody who is an advocate. And people come to me constantly asking, I'm feeling suicidal, what do I do? And of course, the first answer is go talk to a professional, but they need some kind of immediate relief. And so, hey, there's this book that has the skills that you need. Yes, Tally, thank you so much. There's this book that has the skills that you can look through in the meantime while you're looking for a therapist, because that doesn't happen overnight and all that. So it's been an awesome little piece of the toolbox that I've been able to offer to people as a resource. And
It is. Yeah, it's so useful to be able to give somebody something immediately.
Yes, that's exactly what I'm talking about. Yes.
Yeah, it's so useful. And so many of us, we are taught, make sure the person gets into a mental health provider and stuff.
Right.
Yes. But also something tangible, something someone can do immediately.
Right.
That's so powerful. And we'll talk about it later, but that's why this is tied to this Now Matters Now website that we created, so that people could watch videos that would help get them rolling on these different skills, and they could get access to that for free.
Got it. Yes. And so I want to hit the questions because they are super relevant, and we'll kind of weave back into everything. Yes. It's really more of a coping skills building support group, which is amazing. Yes, I agree, Silky. I agree. Okay. So the question we had is, at which point do thoughts of suicide become more of a suicidal thoughts issue? If it's occasional or a one-off, is it an issue, or does it have to be a pattern or a specific frequency?
Yeah, there's no exact agreed upon answer to this question. But what I would say is that, on the far left, what we have is that essentially most people, or large numbers of people in the population, will have suicidal thoughts at some point in their life, from the I just wish I didn't ever have to get up again, to the more significant. Very few people will move to the category of thinking about how they would do it, or trying to make plans for how to do it, or attempting. It's really when you start to get into the category where those thoughts are persistent and they're interfering with your life, and or where you start going down the path of thinking about how to do that you want to you always want to take it seriously, because it is a symptom or a sign that something, it's trying to tell you something. But especially when it starts going that direction, then you want to say, okay, now's a good time to learn more about this, to get some additional support, to understand why these might be happening, and to enter a new period of understanding. I think that's what's really, very few people would say that there are benefits to having suicidal thoughts, but I would say that if you end up in that experience, there is an opportunity for you to have a life-changing experience of understanding yourself differently.
That's beautiful. That if you can walk away having benefited somehow from something, then it's kind of, it gives it meaning, it gives it purpose, and then that makes it a little bit better. I get what you mean. I think, right? Did I say that right? Or did I make that sound worse?
No.
No. So the next question was, can you describe the practical differences between cognitive and dialectical? Like, how would they differ in a therapy situation? Well, I think it's the setting and what you're focusing on, right?
Yeah. So in the dialectical behavior therapy, the treatment was originally developed for people who were chronically suicidal, who'd had repeated self-injury behaviors, hospitalizations. It's really developed for people who were more severe.
Mm-hmm.
Now, we are finding that it's beneficial for lots of different types of people, but the focus was very much on emotions. If I sat down with a DBT therapist, I was focused on emotions, and I was really focused on getting suicidal thoughts and behavior under control. And if I walked in the door, my therapist would ask me to give them my diary card, which is, there's an example of a diary card on the Now Matters Now website, free resources. They'd ask for that. Then they'd look over my diary card and go, okay, it looks like on Wednesday, your suicidal thoughts really spiked. And that you used opposite action that day and you had some success. That was the highest day. I'd like to talk about that today and talk about what that experience was like, and go from there. So it's really structured around getting suicidal thoughts and behavior under control first, whereas CBT hasn't always had that particular emphasis because it wasn't necessarily developed for that population.
Yes, I see. I see. So, and something that I've learned in CBT is how to take my emotions and kind of not, the approach to emotions is different, because through CBT, I've learned that my emotions are passing, and that I can accept what's happening. That's not necessarily a dialectical thing. Would be to give like a tangible, it sounds a lot more, what was it? Not tangible, not numeric, but like there seems to be like an actual. No, I lost the word. It's gone. It's gone. It's gone. I'm sorry.
Well, and I think too with CBT, super awesome. There's a lot of focus on deconstructing your thoughts, right?
Yes.
Where it's like, how accurate is that thought? What are the assumptions that went into that thought? And there's some of that in DBT, but that's a real important focus of CBT.
Quantifiable. Yes.
Yeah, quantifiable.
Quantifiable. Yes. It looks like just the card itself, like it looks like there's a lot of pieces, a lot of like tangible pieces that you have, right? Like actual numbers, actual data, things that you can kind of point to and say, you see this, that now we're going to like dissect that and get these pieces out of it. Which is a lot less freeform than CBT is.
And the best is when somebody has their diary cards for a year and they've entered them into the computer and made graphs on all of it. And like you start to look, oh, wow, it is around the holidays that you do really well or you do not really well. Like you start to see these patterns, and I'm a nerd for that. I really love it. But I think that's a really cool piece of DBT too.
Are there any apps that you like to use for this kind of stuff? Because I use Dailyo, and that's exactly the purpose that I have with it. And when I go to my therapist, because I see her like once a month and a half. And so I can literally show her like a graph of here's how my days are. Because it asks you every day to enter how you're doing, what you did that day, what your goals were versus what you did, and all. Yeah. So you get, again, tangible data.
Yeah. So I've used different dialectical behavior therapy apps, but I've come back to essentially just my own Google form.
Got it. Oh, okay. Okay.
Yeah. I just have a link on my desktop, and I, keep changing and tailoring it. I should try and pull it up so you guys can see what's on my diary card. But yeah, like then I just at the end of the night, I enter that in, and then I have that data if I want to analyze it in some way.
Oh, that's so fascinating. That's really cool. Okay, so but you do have to remember and be diligent and do this daily, right?
Yeah.
Yeah,
Mm-hmm.
that blissful split. Yeah, I have that with my bullet journal. I realize I pretty much always have a day and a half each week where I'm only good for sleeping. Right, but that helps you recognize
Yeah.
that pattern, and then once you recognize the pattern, you can do something about it, right?
Yeah, because when we're in it, it's just so hard to realize there's any pattern to anything. And that's the nice thing about a therapist is they help provide the structure to start recording this stuff so that you can start to see the patterns. And then if a therapist helps get you in a pattern of recording, that's easier to maintain long term too.
Right, right, right. And I mean, it also feels like there's more tangible progress as well. That seems like that's something that's really important to me. I don't you can the fact that you can go back and not just evaluate yourself, but also say, last Christmas I had this many panic attacks, XYZ, and this Christmas, look, I'm doing great. Like that's a huge that's a huge thing that just using the apps has made a huge difference for me. So yeah, neat.
Yeah.
So one of the questions is we have one more question, which is it difficult for somebody to do self-care for themselves when they're being diagnosed with I suppose this person means diagnosed with something severe and then they have to go through DBT. So is it difficult for somebody to do self-care as they're going through DBT?
Mm-hmm.
Or is it part of it?
Yeah. Make sure I might not answer the question you're asking, but it's a lot of work to be in DBT.
Mm-hmm.
It's a lot of work. The good news is that the work is on self-care.
Mm-hmm.
And sometimes that self-care doesn't look like the type of self-care that, sometimes you hear a lot about, like the tea and the,
Bubble baths.
bubble baths and stuff like that. Yeah.
Right.
Some of it is like self-care in the sense of changing the way you have conversations with other people in your life so that you're more likely to get what you want. But in the meantime, it's uncomfortable because your brain is doing something different. It's phrasing things a different way because they might be more likely to help you get what you want, but it feels uncomfortable. So
Mm-hmm.
it's a little bit like torture, but in a good way. So
I think any therapy is torture if you want to look at it that way. Like it's tough. Like I have lived with PTSD, so I have walked through, having to walk through your trauma in order to confront it, in order to go through it. That's not fun, no matter what therapy you're in. Yeah.
Yeah. And that's the thing about brains. You were talking about brains last hour. It's that they don't like to do new things because they don't have, a network for that. They don't have a neural network for the new thing yet. You're literally forging new pathways to your brain. And so learning and doing new skills is uncomfortable. So yeah. And Talis is asking how DBT differs from a life skills workshop. I think it's because the skills are so concrete around how do you manage emotion.
Mm-hmm.
How do you manage emotion is such a huge piece, from the intense, overwhelming emotion that is 100 out of 100 or 140 out of 100 to the to how do you reduce your emotions overall so that you're, on a day-to-day basis, you're not at a 50 out of 100, you're more running at a 30 out of 100. How do you reduce your emotional baseline so life, you're not always living in such a heightened crisis state. So it's much more focused on that.
Right.
Yeah.
Are there certain disorders or challenges that might just not work well for DBT, or do you feel like DBT is great for everything, pretty much?
Well, I am somebody who loves DBT, so you always have to take something like that with a grain of salt. But I also am an expert in it, and there is evidence to suggest across a number of mental health problems that it's useful, from eating problems to bipolar disorder to anxiety problems to depression, and different populations as well, people in Native American, different groups. So I guess I would say yes, it's going to be used in different ways. Like maybe if you're struggling with, it depends on how much your life is being impacted by whatever you're struggling with.
Okay.
And if your life wasn't being impacted, let's say it's being impacted at a 50%, the amount at which you would need that full package of DBT might be different than if your life was being completely annihilated.
Right. Right.
So if my life is like impacted at a, like, 50% disrupted, maybe I could just learn the skills in coordination, just attend a skills group and learn stuff online in coordination with a therapist every couple weeks. Maybe, I don't know.
Got it.
But there's some variation there.
Got it. Is it so? Tardy Microbe is asking what is a great therapy for autism, but I think they mean like maybe is DBT helpful with autism? But I'm not sure what the if you understand the question, that's good. We can ask them to clarify too.
That's a great question. I know when we did our when we did suicide prevention social media chat not too long ago, one of the leaders of that is her background is in autism. She struggles, or she experiences autism or lives with it. And she talks about how she finds it extremely helpful. I have to admit, I haven't looked lately to see if there's any studies on it in autism. But especially useful is the piece around relationship stuff and some support and guidance for like how to have that go more smoothly.
Parasocial relationships, handling them better.
Yeah. If our relationships are stressful for you, DBT definitely has a whole section on, they call it interpersonal effectiveness, that anyone can benefit from. But if that were a pain point in your life, it would probably be useful.
Got it. Yeah. Got it. Cool. You guys keep asking your questions. These are so good and they're fueling so much good thought. Okay. So, I know I touched upon criticisms, but are there any specific criticisms that you're like, this is something, but we're working on it, or this is something that like I have heard, and in that case, it is better to supplement it with XYZ. Like, is there anything like that you would point to? Again, I know with a grain of salt and stuff, but
yeah. I think one of the things that you can, what I've heard a couple of times before is that with all of these coping strategies, some of them are like about acceptance and mindfulness and tolerating things and getting along with people. And sometimes that can seem like, okay, you're not, like you're the problem. Or it can seem like you should stay in an abusive relationship or something. And that's never.
Oh, I see. So it's more, so it can be seen as like you're a constant problem to be solved. You're the constant problem to be solved, and there's always like a solution to you. That's very methodical. I can see, but I guess the same argument can be and has been made against CBT and other therapies that I'm aware of as well, because that is that's the difference between most psychology and then the positive psychology movement, where in positive psychology, the idea is that like we focus on what is good, what you are doing well, and focus on cultivating that instead of saying, whereas psychology in general, like modern psychology, is very much about what is broken that we can fix and how can we fix it in the best way possible. But that's a different, I love philosophy of psychology. We could talk about that for sure, but that is a different
I think that there's some really unique things about dialectical behavior therapy that aren't built into other therapies. Like in DBT, the patient can never fail. So the treatment can fail, the therapist can fail, but the assumption is that patients can never fail. And there's also the assumption that patients are always doing their best, but at the same time, our job is to support them to do better and work harder. There's this assumption that all patients are doing the best that they can, or clients, whatever word you want to use, which I think is really interesting. And then also explicitly built into this that no one was ever supposed to be forced to get DBT. It was always supposed to be a voluntary treatment. So in organizations where it's involuntary, that's definitely not the way it was designed. Maybe it works, I don't know, but most things that are involuntary have a harder go.
Just in general, any treatment, whether you're talking about somebody who's going through,
And we just weren't ever allowed to take patients if they were being required to be in treatment, because that was not what DBT was intended to do.
Yeah. So. Well, it just doesn't work. Forced treatment. I don't know. I have not seen research that says forced treatment works better than somebody coming in voluntarily.
Yeah.
Would that not be an issue to people who have a need to please others? Would it not reinforce that? Oh, so you mean, Tally, you mean DBT's like constant need for improvement? Like that would reinforce somebody's
Oh
need to,
yeah.
yeah.
That's my worry was always was the same thing as like, okay, if there's this assumption that I can always do better for the perfectionism person,
Yes.
that is so that is something I call out at the beginning of therapy with everyone is uh that this has to be focused on health and wellness, and for you getting better may have to do with being less perfectionistic.
Mm-hmm.
That would mean doing better would be being less I'm not using the right word here, but rigid about
Yes.
things. And
Yes.
so it would be very tailored to the person, but I had the same exact worry that you have when I first learned about it.
Yeah. Okay. Okay. Is there a way to quell that?
Yeah, I think you just say like, what is your tendency? If you have a tendency towards perfectionism, like we're going to keep a real close eye on that,
Right.
because it can help them get a lot done in DBT, learn a lot, practice a lot, and there's a lot of benefits to it.
Sure.
But we don't want the perfectionism to get in the way of new learning.
Right.
But
Right.
yeah,
Yeah. The difference between people who do well if they want to and people who do well if they can is subtle and yet huge. First one's a motivation issue. Latter is skills and resources. That is interesting. That's a really good way to put it, Bliffle. I love that. I love that.
and I would say it too. Like, I would say it's all the same thing. Like with motivation, I may want to be motivated, but not know how, and that's a skill in itself. How do you do something when you're not motivated is something to be learned. Does that make any sense?
Yeah. No, I
So
think so.
yeah, yeah. Instead of like, well, I'm not motivated, so, and I think this is separate from your point.
Okay, that's fine.
I'm not motivated, so like that's the problem versus but anyway, that like if I'm not motivated, that's actually a problem that we can approach with skills.
Mm-hmm.
Or if you feel two ways about something, like maybe part of you wants to learn new coping and part of you wants to stay in bed, of course it's completely true and reasonable.
Right.
How can we apply DBT skills for that situation when you feel more than one way? That's called a dialectic.
Got
Mhm.
it. Got it. It all comes around.
Yeah.
Sorry. I'm sorry I keep coughing, guys. I'm not at 100%. Could it be then used to help those who have a need to please, to reduce their overt efforts to please others over their own needs?
Yes. So the interpersonal effectiveness skills, if you had identified that perfectionism was a problem for you, in there would be the steps for what to do. It's called Dear Man, to say no, um,
Uh-huh.
or to ask for things for help for yourself. If you're used to, doing things for everyone else all the time, that's one version of perfectionism. Then there would be specific coping strategies, Dear Man, for how to do that, or how to maintain your self-respect is another set of skills called FAST skills, FAST.
Mm-hmm.
Mm-hmm.
Neat, neat. Silken, thank you so much for being here. This is Dr. Melissa Brown with CDC. Great discussion. I am so excited. Thank you so much for being here. It's awesome to have you.
Hey,
Yay.
Melissa.
Yay. Oh,
So
do
good.
you guys like know each other? You go back or?
Yeah. So I didn't know that was you, Melissa. Yeah. So I mean, I feel like I know her more than I do, mostly over Twitter. I want to
Okay,
know.
got it.
So.
No, that's how I know most
Mhm.
people nowadays. So yeah, no worries, no worries.
Mhm.
CDC, no germs. Yeah, I know, and I'm sitting here coughing and being part of the flu statistic. Uh, live on show. Watch this woman fall apart. No. Okay. So, how does somebody go about finding a DBT therapist that is like skilled in DBT? Are all of you trained under Marsha Linehan, or like how does this work?
So it depends. So if you're somebody who, let's say, I'm going to put two categories. One, the person who's struggling with severe suicidality,
Mm-hmm.
suicide attempts,
Mm-hmm.
self-injurious behavior, and then the person who is not in that category, who's struggling with intense emotions that are affecting maybe their eating or they're drinking too much, or they're having a hard time getting out of bed, or they're engaging in anxious, really intense anxious behavior. Those would be two different people. For that second group, I would start on Psychology Today. and search under DBT, because as far as I've been able to tell, that's the fastest and easiest way to find people in your area who identify as having some expertise in dialectical behavior therapy.
Mm-hmm.
Now, that's not going to be that meaning that necessarily they've been trained fully in the way that Marsha Linehan, the developer, would said as okay, but they're going to have that understanding, exposure to know how to talk to you about it. And then for the person who's really, in a life or death situation, I would go to the behavioral technology website, and I'll give you that link. It's also on my website, ursulawhiteside.org. At the bottom
Bam.
of the ursulawhiteside.org, it's at the bottom is a link to that website, and
Mm-hmm.
you just put in your state, and then you can look up DBT therapists. So that's probably the easiest way. Yeah.
Awesome.
Those are the ones that are really well trained. This behavioral technology transfer group, they train therapists, and you have to have essentially 2 full weeks, 40 hours, 80 hours of training in order to be qualified.
Mm-hmm, mm-hmm. So like most all therapists, each DBT therapist would specialize in certain mental health areas. It's more of a method of treatment than a catch-all thing. Is that right?
Well, kind of. Traditional DBT is really for that person who's at high risk of suicide, and that's where I would go to, like, ursulawhiteside.org, and look at the link there for a really highly trained DBT therapist.
Mm-hmm.
But then there's people who are trained other ways but have some additional DBT training,
Mm-hmm.
and they incorporate that into their specialty. So yes-ish. Yes.
Yes-ish. No, I like that. I like that a lot. So you guys know on my website, I have a link to Psychology Today. I have a link to Rise Above the Disorder, who will help you if you're looking for a therapist and don't necessarily have the means to see a therapist. So all of those resources are posted on my site, and I posted a link to that. And then Ursula Whiteside site will direct you everywhere else, including Now Matters Now. I want to hear all about this.
Oh yeah, I'm excited to talk to you about it. It's one of my favorite things. Yeah, but so, to kind of answer a few other questions in the chat. Yes.
Oh, yes. Sorry.
No, that's okay. DBT skills, I know almost anyone, if not everyone, can benefit from understanding and learning these DBT skills, which are a lot of coping skills that Marsha Linehan pulled together that are really focused on managing emotion.
Mm-hmm.
So almost anyone can benefit, whether someone said dysphoria, yes, anxiety, yes, that there would be some benefit, and you should have access to as much information as possible. And I think knowing what the DBT skills are is important. And that's why we created Now Matters Now. So way back, and I worked with Marsha Linehan, the developer of DBT, from 1999, and in her research lab until 2008. Then I went away on my clinical internship for a year, and then I went to essentially Kaiser to work in their research institute, and I hired Marsha to work on a grant that I got in order to develop Now Matters Now. But the reason it came about was because when I went on my clinical internship, when I would meet with people after they'd had really serious or severe, I guess is what I mean, suicide attempts, or they were going to the inpatient unit, or they were on the inpatient unit, it was so hard to get people into treatment. Like, DBT was obviously the treatment
right.
that they were best, that they would be best connected with. But I couldn't get people into treatment because it's so expensive. There's not enough providers, and the waiting lists are really, really long. And like we were talking about earlier with the workbooks, like, you want people to have something immediately.
Right.
You want them to have something take away, because that's the moment it matters. That's when they're in crisis. They're really saying, I just tried to kill myself, and I'm here right now, and I want help. And I would be like, okay, in 6 months you might be able to get in, to see a therapist.
Right. That's not, what do I do with that? Yeah.
Yeah. So what I would do was I would refer people to this really great website called Dbt Self Help. So I usually on a piece of paper, their discharge summary, I'd write Dbt Self Help, and on the other side, I'd write a caring message just saying, like, keep in touch. Let me know if it doesn't work out for you to find a therapist. I want to help you do that. But essentially, when I got done with that year of clinical training, where when I was no longer in the hospital all the time, I was thinking, like, man, we could do even more with this. And so essentially we created this website, nowmattersnow.org, that's video based, and it's videos of how to do DBT skills, taught
That's
by people. Yeah,
amazing.
how to, right? Taught
Yeah.
by people who've been suicidal and used the skills in their own life. Um, so
It's
it's
nowmattersnow.org.
yeah, it's sort of like a tricky way of like teaching someone DBT without them having to get into therapy. It's not, obviously it's not DBT therapy,
Mm-hmm.
but it is
It's not
introducing
the
people
same.
to the ideas and the concepts and giving them examples and then showing them they're not alone. That was another big idea with this website, is you are not alone. We've been there too. We call ourselves Team Now Matters Now, and there's about 30 of us who are open about having had suicidal experiences to help build this website. And we also use the make sure that healthcare providers know about the website in order to share that as well. But yeah, it
This is
includes
incredible. This is
includes a safety
amazing.
plan, includes diary cards, includes videos for how to use cold water when you're in an emotional crisis.
Right.
Yeah,
Oh
tons of
my
stuff.
God. Oh
Yeah.
my gosh. Yes, connected in this building. How do we is there any way do you guys need volunteers? Is there any way people can help, or do you just need people disseminating this information?
Dissemination is a really big piece of that
Okay.
piece of it. I also, definitely if you would follow on social media, or if somebody is really passionate about DBT, has benefited from it, and is really good on social media, it's 100% volunteer. Like, we are a nonprofit, but I've never taken a salary or anything. So we're always looking for people who would be willing to help with social media. And so you're welcome to contact me if you have some interest in that, of
Got
course.
it. Okay. Well, that's good to know that you need somebody. If anybody's interested in helping out social media wise, you guys,
Mm.
you heard it here first. And
Yes.
Tally, I would love to change the color of links, but I cannot. So depending on where you're looking at it, the link is that color. I have no say over this. But you could definitely put in a ticket with Mixer. Yes. Not the website itself has yellow in it. Oh, okay. All right. That's different feedback. Okay. Okay. All right.
Yeah.
Sorry.
Oh no.
Okay. There was a question. I wanna make sure we get to it. Is there any part of DBT that you would like to see adapted for teaching kids in school? So coping and emotional management skills, et cetera, et cetera.
Yeah. So there is a DBT in Schools book that was written by a dear friend of mine, Liz Dexter Maza, and her husband. And so they have a whole program for DBT in schools that has had some real success. So yeah. Mm-hmm.
That's awesome. That's awesome. Okay, got it. That's really neat.
Yeah.
Guys, ask away your questions. Ask away your questions. Okay, so we found a therapist and we got to DBT. Is there any kind of anything that I don't know, any other remarks that you're like about DBT that you want to make sure people know?
Um, I think maybe one thing I could describe is the way that the skills are structured, right?
Mm-hmm.
Like they're structured into, the foundation is really around mindfulness and how you bring that into the rest of your life. And all of the other skills is so important. So
Right.
there's a big section on mindfulness. There's a big section on emotion regulation, how to regulate emotions. Then there's a big section on distress tolerance, which is how to get through a crisis without things getting worse. So, and then there's a section on interpersonal effectiveness, you know, how to get what you want in your interpersonal relationships. So those four things are in DBT, in that class or that skills group, as they call it. Those are the major components of it.
That's amazing. That's really freaking cool. This is all really exciting and awesome and makes me super excited. Do you guys have any other questions before we let Ursula go? I don't want to let her go. I want to like pick your brain forever and ever. But at the same time, hey, if we can get you out of here, then that means you answered all the questions. That means everybody's happy. Distress tolerance is one of the more important things I think would be helpful, applicable to autism, which I caught that before. I didn't want to out you, Joel Marie. I didn't want to be like, that was Joel Marie. So just in case, I don't know why, just in case. So, but you talking about it right now, obviously that's fine. But this is the person that Dr. Whiteside was talking about before.
Okay.
I don't have a question, but I do love your jumper. That's really your sweater is cute. It is
Yay.
cute. I like the little moose on it.
Mhm.
No, it's cool. Hi, Ursula. Yay! Excellent.
Yay. Hi, my
Excellent.
friends. Hi, my
Aw. Okay, tell us about the books. Tell us about the books. Like, kind of, like, should I buy one of these books? Would this be helpful to me in any shape or form if I just had it, but again didn't have access to somebody who
Yeah.
can give me DBT right now?
Yeah, I think that the combination of the website and the book, and we're really like now starting to get moved with adding more video to the website, the nowmattersnow.org website. The combination of those two things, like this is the book, Marsha Linehan. The combination of those two things, I think, could be really useful for somebody who can't get in to see a therapist, or who wants to learn more about emotions and how they run their life, and they want to run their life instead of emotions running their life.
Got it.
Yeah, so that I think that that's definitely worth it. Speaking from personal opinion, that's I would have I would have died and gone to heaven had I discovered this when I was in high school.
Yeah. Same.
There's some accessibility things where sometimes it's more wordy than it should be. And so also feedback about, for example, Now Matters Now, the website is in yellow, and it's possible that might not be the easiest thing for some people to read, but there's only one page that's mostly yellow.
Got it.
But yeah, I think that having those workbooks, I think, is really important. One thing that we could talk about is stop, drop, and roll before I go to, if that's okay.
No, let's talk about it. I want to hear it.
Okay, so there's this, essentially what I've learned over time is that that emotional fires are a lot like physical fires.
Okay.
And in a physical fire, you can do fire prevention. You can be in a fire, like there's a fire in your building, or you can be, worst case scenario, on fire physically.
Right.
Well, the same is true with emotions. Like you might be doing work to prevent emotional fires by getting enough sleep, eating, healthy, taking care of your relationships. But you also might be in an emotional fire. Let's say things are going really poorly at work and you haven't been sleeping and you have a relationship struggle. Or you might be on fire emotionally, where something really bad just happened, like you find out that your partner has had an affair. Your emotions are engulfing you, like you're on fire emotionally.
Right.
What you do when you're on fire emotionally is different than what you do when you're in an emotional fire, because you need something really, really powerful and fast acting to bring down that emotion quickly. And one of the things on the Now Matters Now website under crisis help is steps for what to do. And one involves cold water, because cold water is one of the fastest ways we know to shut down our physiology, faster than taking benzodiazepines or drinking alcohol or doing all the other things that we do to try and like regulate ourselves. And so using cold water can help change your physiology very rapidly. It can like reduce your heart rate really quickly. It's also really important for people to know not to make any important decisions when they're in a really heightened emotional crisis, when they're on fire emotionally. And then finally, the third step of this sort of stop, drop, and roll for being on fire emotionally is that you get with somebody else, either via video chat, in person, but you find someone trusted to be in your presence and to help you get out of your head, because when people are in that really heightened emotional state, they get so, we call it myopia. We're so focused on the negative, sometimes that's suicide, that it can get pretty dangerous.
Right.
So, yeah.
Wow. Okay.
Yeah, thank you guys.
So you can literally put out your fire with water, is what I'm hearing.
Yeah, pretty much. So you just fill your sink with very cold water, put some ice cubes in it, put your face in the cold water for 30 seconds. And if you have a Fitbit, it's really great because you can see your heart rate decrease. You're holding your breath while you're doing that. And there's a video again on the Now Matters Now under free resources on how to do that.
I've also heard of the really awesome, if you're thinking of self-harm, holding an ice cube. And I offered that to somebody and it like blew their mind and yeah. But that's one of those things that, again, somebody who's a non-professional can offer as a quick resource to somebody who's suffering right now. Because you're not going to be like, I'm sorry, I know something, but I can't tell you. So so you need to go and wait 4 months to see a professional. Please do not. I can't tell you about this ice cube trick.
Yeah.
Yeah. So are the books useful as self-help or only recommended with a therapist at hand? You kind of answered this, but
Yeah, it depends on what you have access to. If you don't
Okay.
have access to a providers, by all means, get what you can get,
right.
you know, and start getting going. Yeah, it just depends.
Got it. Got it. And then somebody asked before, and I just want to make sure that we acknowledge the question, even though we did answer it before. Is there any part of DBT that you wait? I'm missing it. I'm missing it. Shoot, where'd it go? It was definitely a question. Oh, does DBT help with social skills? The answer was yes. We kind of talked about that before.
Yeah, I learned so much from the interpersonal effectiveness section in the DBT skills. The main skills are Dear Man, Give and Fast. Dear Man is about getting what you want, asking for things and saying no. And then the Give is maintaining and improving relationships. And the Fast is improving your self-respect.
Mm-hmm. I love it. I love it. I love it all. Ursula has dogs, all caps. Woof, woof, all caps. This is a notification. Urgently. So I think you have dogs. Is that right? You don't have to bring them on stream, but.
I wish I have a cat.
Okay.
She's actually with the fam, not with me right now. And she's ridiculously cute. And there's a Meow Matters Meow. Okay, that I need to put in the chat. There is a Meow Matters Meow.
Oh, it's a website?
Yep.
Oh my God.
Meow.org.
Oh my God. Yes, M's got a corgi. Yeah, SPSM chat knows about my corgi, Meow Man. Okay, I'm going to follow this link while we're on stream just because I can. And because I know Now Matters Now because I've been playing around on it. Oh my God. Got it. Got it.
Yeah. And so there's a cat in the middle that's got her paws on the keyboard. That's my cat. Her name's Sasha Fierce.
Oh, of course
so
it is.
bad.
Of course she is. Oh my God, this is fantastic. Yeah. What is this? Have you
we want to have a parallel website to Now Matters Now, like where you're like, okay, I'm out. I can't do any coping skills.
Yeah.
Where you can watch cat videos and dog videos.
Oh my God.
The idea.
That's amazing. So now Meow Matters Meow. That's so good. Oh my God. That's the awesome. Yes, that's so awesome. I'm so excited about it. Oh my gosh. Do you have any other closing remarks? We've made you have like 40 closing remarks, but do you have anything else that you like want to make sure that people know? There's the links. I'm dropping them in chat. Is there a bark version of the books for my kids?
It'd be nice. Yeah. There are some kids DBT skills books, but I'm not as familiar with them.
Okay.
Yeah. No, it's so great to have you. I'm so appreciative. If you follow me on social media, that would be fantastic. So I can share stuff. I'm at Ursula Whiteside, and there's a Facebook page and Twitter and Instagram. So thanks you all.
She is fantastic, and I love all of her tweets and everything. Dialectical Behavior Therapy. I freaking love that. Thank you so much for being on. I'm gonna pop you off. Have a wonderful rest of your night.
Okay,
thank you.
See you guys later.
Bye.
Bye.
1 second, guys.